So again, thank you for joining us for today's program. Um, for those of you who are joining us today, many of you may be familiar with NAMI Greater Cleveland already. For those of you who are new to NAMI programs, we are the National Alliance on Mental Illness, and we provide programming that empowers and provides uh, empowerment for an improvement of quality of life for individuals living with mental illness and their families. And we do that by providing education, support, information, and referral and advocacy. Today's program is a psychoeducation webinar and is also part of our um, faith-based initiative here at NAMI Greater Cleveland. Just a few notes, please make sure you remain muted during the presentation. Please utilize the chat feature if you have questions. We will have time for Q&A. We have allocated 90 minutes for this webinar, but it may not run until 1:30. But that does mean, however, that we will have plenty of time for questions. We're also happy to those of you that are joining us who represent faith communities or who are faith leaders yourselves. This is a presentation that we would be happy to offer to partner communities in Cuyahoga County if this is of interest as a private presentation. Very happy to have Angela Banks joining us today. She is one of our psychoeducation presenters with NAMI Greater Cleveland, runs her own private practice and is a licensed professional clinical counselor. With that being said, I will hand it off to Angela to introduce herself and begin our presentation. Thank you for joining us.
Thank you, Matt, for the introduction. Is everyone able to hear me okay?
Yes.
Awesome. Awesome. So welcome. Thank you so much for joining us today. Our presentation on how faith communities can support individuals with mental health conditions. So I'm so excited to be here today. I think there's so much for us to talk about in regards to this topic. So just to kind of give a little bit of my background, I know Matt gave an introduction. So I am a licensed professional clinical counselor. So in Ohio, a licensed mental health professional. And I'm also a educator, a researcher. So I do a lot in regards to the mental health profession and a lot of research in this specific topic about how we can integrate spirituality and mental health, as well as integrating mental health treatment and what that looks like. So to kind of get us started, I wanted us to start with just some background information in regards to mental health. And of course, now my slides wouldn't turn. So first, let's start off with some statistics. 1 in 5 adults live with a mental illness. And you'll see me kind of use different language throughout this presentation. One thing is that language is really important. How we describe things, how we define things, that matters. So we say mental illness. For me, that is the term that most folks are most familiar with, but we can think of it in terms of it being a mental health condition or somebody that might have some symptoms of mental health related to like distress psychologically. So 1 in 5 adults live with a mental illness. That's a significant amount of people, 20% of adults living with mental health, some sort of mental health condition. And 1 in 25 adults live with a serious mental health condition. So this is something that's really debilitating to their functioning, meaning that it impacts their life. So that would be like the more severe conditions when we think about someone that might be living with psychosis or even some substance abuse, addiction issues. Those can be really debilitating. Something that's really impacting their functioning, living with some sort of trauma, post-traumatic stress disorder, that can look different for people, but on the spectrum, thinking about it in terms of somebody that's living with a very serious mental health condition, that maybe stops them from being able to function in ways that they were able to before. Then we're just talking about adults here, but when we start to really look at it, we see that these things develop prior to adulthood. They start to develop in childhood, really, but maybe won't actually be able to give it a diagnosis or even treatment until someone is adolescent, and you start to see it come out in different parts of their life. So 50% of chronic mental illness or a chronic mental health condition starts before the age of 14. So really young folks are dealing with some sort of mental health issue. 75% of chronic mental illness starts by the age of 24, which we hear all the time that our brains aren't even fully developed at that age. So kind of keep that in mind throughout the presentation, just how much people may be impacted by some sort of mental health issue. And you know, we've always had this, the way we talk about it, it's not really out there. So just kind of keep in mind how many people might be struggling or challenged by this in some way. Just over 10 million people 10 million people over the age of 18 have more than one addiction or mental health disorder. So there's lots of folks out here who are not just dealing with one sort of mental health issue, but multiple. So I wanted to present this information so that you could keep it in mind that there's so many people who are dealing with some sort of mental health condition and not always receiving the support or help, the understanding that's necessary in order to deal with the symptoms and the way that it impacts your life that requires that amount of support. So it's not always available. So in our presentation today, we're really going to talk about, I didn't have an agenda on the slides, but we're really going to talk about some introductory information about mental health, just so that we're able to recognize it more and realize that it's much more prevalent than maybe we've thought about it in the past. And then also start to talk about how we could integrate mental health and mental health treatment and spirituality. And also think about some of the historical things that go along with that. Something to keep in mind, I did my best to make this as inclusive as possible. So I'm not only referencing one specific religion. We want to be able to encompass people of multiple faith communities. So keep in mind that you'll have to figure out ways, and Matt mentioned this can be something that can be tailored to your organization, but you'll have to think about how this can help within your faith community while also balancing the beliefs and the value system that goes along with that faith community. Well, just a little disclaimer. So what is mental health? I keep saying it over and over. What is mental health? So we all have some sort of mental health. All of us are sort of having a way that we are able to function, to deal with challenges, to enjoy life, how our brain functions. That's our mental health. How we make decisions, how we cope with things, how we adapt, how we express ourselves, how we relate to other people. All of those things go back to our mental health and the state of our mental health. So our mental health does not always have to equate to, when we hear the word mental health, we don't have to always equate it to a mental health condition. Mental health is relevant for everyone. A mental illness or a mental health condition is a disturbance in our mental health, a disturbance in our thoughts and our emotions, and it decreases our ability to not only cope with challenges, but also just deal with life in general. It can impact your mindset and your viewpoint. It can impact how you're able to function, how you're able to do things that maybe you did before, how you're able to parent, how you're able to show up and be a part of your faith community, how you function at work. all of those things can be impacted when someone is maybe challenged by some sort of mental illness, a mental health condition, or any type of mental health symptoms. So it's important to keep in mind that there's a difference between just the words mental health and when we think about someone that's struggling with their mental health. And if y'all have questions, please feel free to update them in the chat. I want this to be sort of interactive, and I'm sure things might come up as I'm talking. So again, this is just a visual to sort of support the last slide. So you can think about it, and they use the word you're normal. I don't like that word. I don't think any of us are normal. However, I think that there are normal fluctuations in our mood. There are normal ways that we can deal with things that, and when I say normal, I mean it doesn't have to create an unhealthy outcome for you. So if someone is having like normal mood swings, that could look like, okay, I might have a moment where I'm okay, and then maybe something happens and I become irritable or frustrated or sad, versus, but I can bounce back from that. Versus someone who has really highs and lows, and when that depression hits, it gets really significant, and they're really struggling, and it really impacts how they're able to show up and engage in the world every day. So this is sort of giving a visual of the difference here. Like we can have someone that's like in a healthy state of mind. We can have someone that might be in this really triggered space where maybe they're reacting and they're starting to notice things that they're doing that are different. Like maybe you're like, I'm just been really tired lately, or I can't remember anything lately. Something is happening, or maybe I'm just, my fuse is a little bit shorter than normal. And then we can look at if someone is really struggling, they use the term injured. Now they're aggressive and angry, they're anxious, they're tearful, feeling really hopeless, feeling really negative, like things just won't change, really struggling to make decisions, maybe starting to not show up or not complete things that they would have completed before. Maybe they're not getting any sleep. Maybe they're starting to use drugs or alcohol to cope more than they did in the past. So now it's really important to be able to be aware of like the way someone normally responds, normal for them, versus them responding from a space of like being really in distress, and struggling psychologically. And then lastly, where you're sort of really having issues, maybe having panic attacks, maybe being really depressed, unable to, again, make decisions, sort of that injured to another place. And also thoughts of suicide might come up, or really being heavily into an addiction. You might be stop showing up to things, be really absent. Maybe they'll lose their job. Maybe they're just completely not sleeping at night. That's when someone's like really struggling with a mental health condition. And I believe seeking professional care prior to it getting to that point is the best way to sort of deal with these things. However, sometimes our systems doesn't always allow that, or sometimes we're not able to recognize it soon enough. But this is the space where someone certainly needs to have some sort of intervention, because at that point, they're at risk. So what is positive mental health, healthy mental health, pleasant mental health? Your sound in your body, your mind, and your spirit. You feel you're able to be resilient, like move past things, deal with challenges, deal with stressors in ways that don't always have to cause a huge amount of stress. You're able to have the ability to have meaningful relationships. And I'm going to talk about relationships a lot anytime I'm talking about mental health, because we are a society that is constantly around each other and dealing with each other. And we have this community of people that we're expected to be able to have these relationships with. And it's important for us to be able to tune in and see maybe how we are affected by others or are affecting others, to kind of see, like, is there something going on? That's a great way to kind of gauge where someone is psychologically, by looking at the relationships that are around them and how those relationships are functioning. The ability to live life with a full range of emotions. So that can be different, but you're not always in one state of mind. You might be happy, you might be sad, you might be excited, you might be grieving. Like, there's all these different emotions you're able to have. So you're not always sort of at that just numb space, or you're not always angry, or you're not always just sad, or even for some, being very aware that everybody is not always happy. And it's important for us to be able to recognize that when we do have someone in our lives that always appears happy, likely that's not their actual experience. So usually when we're noticing one emotion all the time, there's a lot of stuff that might be underneath those emotions that sort of need to get sorted through. But again, someone that has like a positive mental health or good mental health, they're going to be able to live life with a full range of emotions. And then they make choices that promote growth and healthy well-being. So someone who is always struggling to make the best choices for themselves, or maybe they are really challenged by life and it causes them to make choices that are not the best for themselves. That does a number on someone's mental health. So that's another way to sort of be able to gauge yourself. Have my choices looked different lately? Have I been operating differently? Am I doing things that are best for me? Because if not, that's something to look at and be curious about. So how is this all relevant to faith community showing up? Again, just giving some background to kind of know when we think about positive mental health, we're including this, all of these things. And when any of this is off, and plus this is not a completely inclusive list of everything that indicates positive mental health, but if these things are off, someone could be struggling, and it's something for us to be aware of. So what is the relationship? And I'm using the term pastoral care here because in mental health, in our profession, there is a specific track you can take in terms of pastoral care. So there are counselors, licensed professional clinical counselors, that actually have been able to integrate that piece into their training as counselors. Why? Because spiritual leaders are the original mental health professionals. Before mental health was sort of emerged into an actual profession, we know historically that used to be something people just didn't talk about. It was something that wasn't relevant. I'm sorry if you all hear there's a police going by, but that was something we didn't talk about. It was something that we wanted to hide. There was a lot of shame tied to mental health, but we also know it's something that has existed since the beginning of time. So before we established this profession, psychology and counseling and social work, all of these mental health professions, spiritual leaders were the folks that people went to in order to deal with the mental health challenges that they were faced with, whether that meant that they were assisting their families with connecting to those resources, or family members or loved ones, or if it was them, they were the guide and the facilitators of that process. Why? Because they provide guidance, support, and healing. It's the same foundation. So figuring out a way to collaborate or work together is really important. And I think from the counseling perspective, from the mental health perspective, that's always really been encouraged, integrating spirituality and figuring out how to help folks cope with their mental health challenges, but also be able to recognize their spirituality and their spiritual beliefs and use that as a way to create healing for themselves and cope with the stress and the adversity and the challenges. Spirituality gives meaning and purpose. Lots of people, when they come to therapy, when people come into my office, sometimes that's their thing. They don't know what is the meaning behind all of this. What is my purpose? What am I trying to do? And I don't have that answer, but I can help connect you and help you to find ways to connect your spiritual beliefs and be able to discover that meaning and that purpose. So there's so much power and healing in spirituality. And when we can collaborate between the two things from a treatment perspective, it is certainly beneficial to clients and to patients. Spirituality also offers this idea of like reflection and self-discovery, and it kind of takes you back to your roots a lot of times and what you truly believe and value. And ultimately, when I approach counseling, when I approach therapy with clients, that's exactly what I want to do, is get you back to that foundation so that you can kind of quiet all the noise and heal and work through things. And so that relationship between pastoral care or spiritual leaders, mental health, it's always existed. But I think because of our approach to mental health as a society, a lot of it has gotten lost. Again, how is spirituality, and we're going to talk more about what I just kind of left off on. I'm not going to just say that and leave it there. We'll come back to it. But again, why is spirituality so closely tied to well-being? Sense of purpose, community is huge. So social support, a sense of connection, hopefulness. We hear it all the time. In some religions, people might say, leave it in God's hands. Having that faith, it instills hopefulness. When I have a client that is depressed, one of the main things that exists for them is that they feel like things will never change. So if I'm able to help them see, what do you believe about that? Or what do you think about that? Or what would your faith community think of that or say about that? Leave it in God's hands, that creates hopefulness. So again, that's just one example, but how these two things are so closely tied together is really important, because so many people rely on their spirituality to deal with the things that they're struggling with in their head and internally and psychologically. So it's so important that faith leaders are equipped to help people through that, help their faith communities through that in ways that are safe psychologically. I see something here in the chat, so I'm going to check it. Okay. Oh, Michelle's saying thank you. Awesome. No problem. I'm happy you're here today. Thank you for joining. So the first thing I want to touch on is, what is something we can do? How can faith leaders, spiritual leaders help folks to maintain positive mental health? What does that look like? You need to check in with them about how they're able to practice self-care. I always say that first. Are they eating? Are they drinking water? Are they able to access healthy food, depending on what community you're in? Maybe not. Are they able to get the appropriate amount of sleep? A lot of times, no, they're not. If they're working or they have other obligations or things that they have to tend to, they may not be getting proper sleep, or they might be so anxious that they're not getting proper sleep. Physical self-care is always where I start. When I do an assessment on a client, I'm like, how much sleep are you getting? How much, what is your daily intake like with food look like? Do you eat breakfast? Are you able to have a lunch? You know, some people can't even have a lunch. I know sometimes I don't get to have a lunch. That does a number on people. Not getting sleep sometimes is one of the main reasons why people are struggling with mental health issues. So checking in with them on their self-care and their ability to practice self-care, because we always tell people, take care of yourself, take care of yourself, take care of yourself. But for some folks, it's not always possible because of various different reasons. And as a faith leader, spiritual leader, it's important to check in with people because that gives them the idea that you care and that you are wanting to address what's actually happening to them. So check in with them on their physical self-care, just the actual basics, and talking with them about that. Do they have access to supportive loved ones? How can the community show up? That's a great way to help someone through mental health challenges. I can't tell y'all how many people come into my office and they don't have anyone, or that's how they feel, or that really is what's happening. They don't have anyone. So just being able to be a supportive person or help them create the community that's necessary and cultivate that community. And when I say community, that can mean 1 to 2 people. You know, it doesn't have to be this huge amount of people, but folks that can support you, be there for you as a person who is going through life with you. Depending on the generations that you're working with or the folks that you're working with, we know now our lives are digital. So we're not always connecting with each other as necessary. So sometimes you feel like you have this community because we're like on social media, but how often are you actually checking in and talking to people and they're going through stuff with you versus you catching them up on everything every time y'all talk? So it's important to gauge how much of a support system a person has. Does this person have their spiritual practices that they go back to? Do they need assistance? This is where your expertise comes in as a faith leader. Help them get back to that. Talk about that. What are the challenges or the barriers to you being able to use some of those spiritual practices or grounding techniques that kind of helped, and talking through them and guiding them in that way? Is it a financial issue? Sometimes people are struggling simply because they cannot afford life. And it's not that as a faith leader, you're expected to change that or fix that, but a lot of shame is tied to financial issues. And a lot of times people don't have a confidant or someone to really and truly talk through that with. So being able to just check in with them, like, is that something that you're struggling with, and naming it with them and just being, again, that supportive person. Psychotherapy is also, again, a great way for people to receive support for their mental health. So having ways to connect them with that resource is important. Again, collaborating. So you're not expected as a faith leader to do psychotherapy with the members of your faith community. You are expected to refer them for psychotherapy and be a support to them as they receive those services, and maybe help them and even reflect on how the things that maybe they're learning are connected to their spirituality. But you're not expected to have to actually provide that service. So it's important, even as a faith leader, to establish mental health professionals that you feel comfortable referring your members to, and being able to feel confident in that. self-help books or groups, so referring them for more support. Books are great. Groups are even better because groups create community. So if you have those types of resources, that is always helpful. Again, regular self-care outside of physical self-care. So when I talk about physical self-care, I'm referencing the basics: eating, sleeping, drinking, those things. And then regular self-care, for me, not getting my nails done, getting my hair done. You hear that all the time. That stuff is you taking care of yourself. But I'm talking about setting boundaries with people, communicating effectively, saying no to things so you're not overwhelmed. Like, what are you doing to manage and balance in life? That's what regular self-care is to me. And then how do you cope with all of this? Are you doing it in a healthy way? Or are you doing it in ways that might be harmful to you or harmful to others? Checking in with them about that. Awesome. Again, any questions, y'all feel free to include them. So let's talk about it. Y'all can upload, you can come off and mute if you really feel like you'd like to. I would love that. How might your spiritual or religious background influence an individual's thoughts on mental health and coping is one question. And then what are some potential conflicts that could arise between spirituality and mental health treatment? And how might you address it? Now, it's like we kind of talked a little bit about this. We have more to talk about, but I want to see where y'all are. So any thoughts on either of these questions? I would love to hear what you all think.
Feel free to put your thoughts in the chat as well, and I can read those out for the group.
Awesome, thank you.
Hello.
Yes, hi.
Hi, how are you?
Good. I can't see who I'm talking to.
Well, I'm on my phone, so I apologize. I don't even know how to work this, but my name's Chini.
Hi, thank you for being with us today.
Yes. So just a response possibly to the first question, how might spiritual or religious backgrounds influence an individual's thoughts on mental health and coping? I think it would help and it would influence in the sense that a lot of times in, say, my spiritual background, we talk a lot about the peace of God.
Mhm.
And we talk about having God's peace that surpasses our understanding of what we're going through. And a lot of times, if we can, we also talk about speaking audibly and allowing our tongue to confess and create things that we would want, even though we might not see them. And I found that in doing just a few of those things, that the more you begin to speak positively, not giving a lot or all of your concern to what's actually going on, I found that it has began to change maybe the thought pattern or just for change that moment that a person is going through, at least for myself. And so I think that my religion and how I use my spiritual background, I think that it's helped in confessing positivity versus what I'm actually dealing with or seeing.
Yeah, absolutely. So thank you so much for sharing that. Like, you're really speaking to kind of what we talked about, instilling that hopefulness, that sense that things and circumstances can change. And it may not even be in your control. It might be outside of you, and helping connect them to that piece of things. Absolutely.
And we also have quite a number of comments in the
Awesome.
chat. We have here, Jackie shares that historically some faith traditions have imparted a sense of shame concerning addiction or mental health challenges. So it's important, Beth and Michelle also highlight this in their comments. As a spiritual leader, if we can show our own vulnerabilities and struggles, it can help open the doors for others to open up and not feel shame. We want to work toward building a stigma-free community where people's lived experience is honored. And also, someone brought up that there can be negative associations with seeking help from
Mm,
counselors or psychiatrists. And so it's very critical that spiritual leaders encourage people to seek um, professional help. So
mm.
there's a few thoughts there if you want to respond to those, Angela.
Yes, absolutely. I agree. There's so much, I think it kind of, I'm gonna go to the next one. I think that's what's coming up next. Absolutely. Speaking about misconceptions, stigma that's attached to mental health. And when we think about spirituality, it's like the two, though we've talked about historically, have been connected to one another. There's also this divide that if you're spiritual, you don't need that mental health support. And there's this other side that if you have mental health support, you don't need that spiritual framework. And neither of those things are true. We don't have to choose between the two of them. We can do both. And I think it's important for us to recognize that because there's so much power in spirituality when we talk about mental health and healing. So yes, stigma, absolutely. In some communities, most communities in our society in the United States and in other countries internationally, there has always been a stigma attached to mental health. We've seen it even in the media. We've seen it in movies, in TV shows where back in the day, if you had a mental health issue or if you were viewed as a person that was struggling, you were isolated and you were pushed to the side or you were ignored or you were oppressed because of the mental health issues that you were having. And so there wasn't this idea of, let me get this person help so that they can feel better or so that they can go through life better. There was this idea of, let me get this person help because they're crazy or because they're causing me some sort of distress. The person was sort of disregarded. And I think that a lot of times that stigma has caused us to really struggle for reaching out for help or even just talking about things that are going on with us mentally, because we don't want other people to judge us. We don't want other people to isolate us. And we don't want other people to treat us like they need to fix us, again, which can be really isolating. There's also this idea that if you do have mental health issues, it's because you lack spirituality or faith, and that's not true at all. Mental health issues or challenges occur for so many different reasons. There's biological, there's evidence that it can be a biological thing. So this is something that you could be born with. There's also evidence that trauma can change the way your brain operates and develops. So there's also a life experience that can impact your mental health. There's also all these different systems we're living in that causes us to feel anxious and depressed and not good enough, and creates all these other issues. There's also family issues. There's also neurological conditions that can occur. Like all of these things contribute to our mental health. So we can see that most of that is outside of whether or not we have some sort of spiritual background. If anything, again, we want to figure out how to collaborate and use the two together. They don't have to exist solely one or the other. And then there's this idea that if you do have a faith background or you are a spiritual person, that guarantees this sense of happiness or this inner peace. And that's just not true. You're still going to be a human, and you're still going to have these struggles and these issues that exist, because it's the human experience. And I think a lot of times there's so much shame that in some communities, people feel like they can't bring up maybe what they're struggling with because they don't want to be told that they, should have this happiness or this inner peace just solely based on their spiritual background. So that's some of the misconceptions that have historically been tied to spirituality and mental health. If you have any other ones that you think you've heard or have sort of existed, we're going to talk a little bit more about stigma, but I'd love to hear that in the chat. I do see here there was something.
Yeah, we have a few more comments.
Yeah, I'd love to hear them.
Yeah, Alan raised a point about religious spiritual trauma and the challenges and kind of disentangling what aspects of that experience a religious leader can respond to from the kind of psychological issues associated with trauma that really need the care of a clinical professional. And I'd like to bring to everyone on this call's awareness that in October, we'll be doing a virtual program on the topic of religious and spiritual trauma with a clinician named Teresa Mateus, who is the author of Sacred Wounds, which is one of the few books focusing exclusively on that topic of religious and spiritual trauma. I did drop the link to register for that program. It's going to be a virtual lecture followed by a moderated discussion between Teresa and myself, and we're really hoping to have a great turnout for that event because we know that religious trauma is one of the topics with the most interest in the intersections between mental health and spirituality. So great to bring that up, Alan. And I see some folks responding to the link that I've put in the chat. So we also have someone sharing that church has been a supportive place for mental health, and that church has referred her to counselors who offer biblically based support, but that it's equally important to go to a licensed mental health professional, especially since we can see one of the other areas of stigma that sometimes occurs in religious communities is around the use of medication or same-sex relationships. So being able to turn to licensed professionals to address one's mental health can be equally important.
Yes, some wonderful points. The piece about religious trauma is huge. I'm so happy y'all are hosting that. That is going to be, sounds like it's going to be a wonderful event. Yeah, that's a big thing, especially in this time, because we know, and I'm sure many of you know, that a lot of folks are now like sort of trying to not be as connected to maybe their faith community or are struggling with that because of religious trauma. One of the things that I throw out there, I try to, even with clients that come in, I'll let them know, it's not the religion, it's the people. And I think we have to remind ourselves in a lot of situations that a person making a decision does not have to stand for this entire thing. So we can't let that one person or those people who may have made a decision to weaponize religion or spirituality to be the determining factor on how you move forward. And that's one of the things that we talk about in healing trauma, creating healthier relationships is how you kind of move past that trauma. So I really appreciate you all bringing that up, because that's definitely something that's present and is a part of all of this. So I'm going to stop my share for just a second. I hope this doesn't ruin stuff, because I want to include in the chat here our activity today. So it's just a quick question of what word, and you can reference just one word. It doesn't have to be anything long. I'm going to put it in the chat. A word that you think of when you think of mental health. So this link here is going to take you, the link I just put in here is going to take you to a Slido, and it's going to create a graphic for us. You may need a code, and I'll put the code in here just in case.
I think we can open it. I was
Okay.
able to open it. Yeah.
Awesome. So if you hit that and you just answer the question there, and then I am going to pull that up so we can look at it. I'll kind of circle back to it. When you think of mental health, what do you think of? And I'm gonna go back to my screen here. Oh, you still need the code. Okay, let me put it in here just in case. That's the code, 2814100. I'll just give you a second here. And I'm going to go back to attempting to share my screen. You can tell me, Matt, if it's sharing okay.
Yes, we can see. Your
Okay, awesome. We'll come back to this at the end, but please participate if you feel so compelled. Just one word. And I want us to go back into talking about mental health stigma, and we'll circle back to our Slido there. Thank y'all for participating. So what is stigma? We've talked a little bit about that. Negative attitudes, beliefs, stereotypes that surround mental health conditions and that surround the folks that experience mental health conditions. So it's not just our beliefs here either, that it actually impacts people because we have these beliefs. So there's one thing to have a stigma, like I have these thoughts, I have these feelings. It's another thing when those thoughts and those feelings impact other people negatively, maybe in ways that harm them. Maybe it stops them from being able to pursue certain opportunities. Maybe it creates problems for them in their lives in other ways and prevents them from functioning in ways that may have been helpful for them. It could be so many different things based off of us just having this stigma related to mental health. And the stigma, it stems from a lack of education. Ultimately, we don't understand mental health. Why? Because we've always pushed it to the side, act like it didn't exist. It's always been so much shame tied to it. It's embarrassing, it's a dishonor, all of these different things when we think about mental health stigma. So it's really important for us to recognize that we not only have these attitudes, thoughts, and beliefs, but these things are actually going to create situations for people who actually struggle with mental health. So if I am a person that has really high anxiety and I go into a job interview and someone maybe has this stigma or this thought or attitude about anxiety, then that will impact that person getting a job. So there's things that we have to think about. We don't have to stigmatize these things or make them a bad thing. We can learn about them and then we know how to deal with them in different ways. And that's sort of what a spiritual leader, the goal is that you're able to help reduce that stigma. And how can we do that? We can reduce stigma by creating safe and inclusive environments, providing resources and support, which is sort of what we discussed earlier, connecting them to providers, providing referrals. There's some therapists that actually work out of churches, like they'll see clients at church. So maybe or host support groups or therapy groups, normalizing discussions, that does a huge service. I mean, that makes a huge shift and change. When we start to actually have these discussions around mental health or about mental health, instead of, again, shying away from them, sometimes they can be intimidating when we don't maybe understand what someone's going through, or maybe they're triggering you, maybe you recognize something in someone and it causes you distress. Again, how can we talk about that? What can we do to show up as supportive and create inclusive environments? We can offer workshops like this. This is a way to show people that we're open to talking about these things, and you don't have to maintain silence around the topic of mental health. It's also reflected in our programming and in what we do and how we show up as a community. So being able to show that we're not afraid to talk about these things, that we recognize that mental health is something that we all experience, and that mental health conditions are not something that we should be marginalized for experiencing, and that we can talk about it, and there's resources and help, and that we support you in pursuing those options. Those are all wonderful ways to reduce stigma in the community and just get the conversations going, because a lot of time that's just what's necessary. We get the conversation going and two people recognize that they have this thing in common, or maybe both of them are dealing with children that are struggling, or a partner, a spouse that's having issues, or a parent that are maybe having issues. How many people are dealing with elderly parents that are maybe going through dementia, or just not able to remember things as well, or maybe they're depressed because they're aging. Like, so many people have this in common, but when we have this stigma surrounding these things, we're not talking about it and we're holding it inside. And I can't tell you how many people, and I'm sure as a faith leader, you've experienced this too. After they talk about it, they're like, I feel better. I talked about it. I got it out. Showing up and being there as a support is huge. So that's a great way to start to reduce that stigma in your communities. And I just want to encourage you all to sort of think of a time when you were really stressed. What did you need from others? That's a typo. From others at that time. And then thinking about your own personal life. Can you rely on spirituality and seek professional help to deal with mental health conditions or challenges? Like, you personally, are you able to rely on your spirituality and comfortably seek professional mental health support to deal with things that you might be challenged by? And the reason that I'm saying that is sort of what was stated earlier. We're naming it, we're putting it out there. We're just saying it. Just want to give you a minute to think about this.
We have a comment from Michelle that says that often spiritual leaders do not seek help for themselves.
Yeah. Yeah, because why are you seeking help? You should be able to handle it all, right? That's been the belief. That's been how we've always operated. Same thing in counseling. The mental health professional oftentimes struggles. We say that all the time about doctors. They make the worst patients. So it's the same thing. Being able to recognize that you're a human. And as you deal with things, you may need that additional support. Thank you.
Yeah, we
All
have
right.
another
Okay.
comment just saying from Dorca saying that you know, it's important that faith leaders be an example for the people in their communities that they are, you know, called to help.
Absolutely.
And they another comment from Jackie indicating that faith leaders can help educate their congregations about self-care, and that, you know, everyone needs self-care, including the faith leader, the leader of the community.
Yes. You take on so much. You know, you're dealing with not only showing up every week or every day as a faith leader, but also everything it takes to show up and to keep that community going. As a leader, so much that comes with that. And then also your life that exists outside of your role as a leader. So yes, you absolutely need to be taking care of yourself. And a great place or a great way to show your community how to show up for themselves is to show up for yourself. I have to tell myself all the time, you know, I'm helping people, but who's going to help me? And I have to be open to that I might need that additional support as well. Even if I have the knowledge and the skills and abilities to treat mental health symptoms, right? That doesn't mean that I have that objective view or that perspective that's necessary to that I would receive from another person. So yes, absolutely, seeking professional help and guidance as a leader is so important. Is there anything else coming up?
Just a final comment from someone who has to leave. Just wanted to express their gratitude for your expertise and what you've shared so far, Angela.
Thank you. I appreciate that. It's been a pleasure. Thanks for coming. Let me just throw out some more tips. What can you do as a spiritual leader? You can actively listen. I have new counselors that I train all the time, and I'm like, just listen. Just listen. You don't have to speak. You don't always have to feel like you need to lead or guide. A part of your job as a leader is to help people reach their own conclusions or sort through their own thoughts. So active listening is so powerful. Showing empathy and encouragement, advocating is huge. Being there to show up for the members of your community and being compassionate, non-judgmental. That doesn't mean you can't help them understand things that might be a moral conflict for them, because that's one of the main roles of a spiritual leader, is to help people sort through that. But you don't have to do it in a way that judges them. It can be in a supportive way. Trauma-informed training is a very valuable resource for everybody, meaning being able to recognize if somebody is going through something that might be traumatic, being able to approach them in an appropriate way, or recognizing when someone might be triggered, recognizing how to use appropriate language, appropriate environment to reduce triggering other people. All of that is a part of trauma-informed training. So it's a very valuable resource to create what we talked about earlier, which is an inclusive environment. Along with that, seeking education about other mental health topics, so not just trauma, depression, anxiety, bipolar disorder, schizophrenia, all of those things, ADHD, OCD, these are things that your folks are coming in with, regardless of the background. So being able to know what that is, even if it's just to say, maybe you should try to seek help in this place because that sounds like this. Just having that education and that foundation can help. And then challenging the misconceptions and the myths that have been historically related to the stigma attached to mental health. That's another big piece of it. So the last thing here that I wanted to do is just give you a minute to sort of think about mindfulness and that concept, which I know many of you within your spiritual practices likely have some sort of mindfulness or meditative practice that you utilize within your spirituality. And if you don't, just recognizing that it doesn't have to be necessarily tied to a specific religion, meditation, mindfulness. All of those things are designed to help us maintain our awareness of what's happening with us in the present moment. We react to things so quickly. Life goes so fast. We're always in the next moment. So mindfulness is designed to help us stay in the moment and stay present, because we often need a way to check in with how does that make me feel, and what thoughts and feelings, emotions are arising from what's happening right now in this moment. And then thinking about how that ties into spirituality and being able to help your faith community members understand how valuable of a resource meditation is. So I just wanted to give us a few minutes here to do an actual 3-minute, very short meditation before we end. This will give you a chance to sort of think about some of what we talked about, check in with yourself, and just take a moment here. So I'm going to share this screen. And I'm going to start it now.
A 3-minute guided meditation. Close your eyes and simply become aware of your breathing. We're going to use the breath to bring you into the present moment. Inhaling through the nose and exhaling through the nose. As you inhale, feel cool air coming into the body and nurturing. As you exhale, feel warm air leaving the nostrils, releasing any tension and negative emotion. Feel your feet connecting you to the earth. Feel your shoulders sinking down. And feel your neck elongating. Relax your forehead, your eyes, your jaw, your ears, and relax all the muscles of the neck. Come back to the breath. The coolness on the inhalation, bringing you into the present moment. The exhalation, the warm air leaving, knowing you are safe, relaxed. Quieten your mind. Let thoughts go by like white, fluffy clouds in a blue sky. Bring your attention back to your breath. Releasing yourself from the past and from the future, fully enjoying this present moment. Feeling yourself cultivating an inner peace, a safe place for you to come. Breathe And slowly open your eyes and come back to the room.
Awesome. I'm stopping share because that was the end of what I have to share in regards to slides. I want to give opportunity to answer any questions you might have. I'm also wanting to share some of the words. I tried to pull it up, but I'm just going to read them off to you that came up from the poll that you all did, which the question was, what word do you think of when you think about mental health? There were several people that said authenticity, well-being, a few people that said love, some people said work, invisible, wholeness, balance, affirmation, care, need, disability, critical, boundaries, coping, and stability. So that gives us an idea that there's a vast amount of ways that we can view the concept of mental health. Everybody does not view it differently. So, I mean, the same. So if we all view something differently, we got to start having conversations about it so we can reach some sort of understanding and be able to deal with it appropriately, effectively, and in ways in which people feel supported. That's all of what I have. I want to hear from you all. I see there's a lot of stuff in here in the chat. So if you have questions too, feel free to include them.
Yeah, thanks so much,
Thank you.
Angela. Happy to take some time for questions before we end. I would like to bring everyone's attention to the fact that we would like you to complete a short anonymous evaluation for us on on your thoughts, your feedback on today's presentation. I did just drop the link in the chat to that survey. If you could all open that up for me and complete that survey. The demographic questions are optional, but if you could answer the first questions, we would really appreciate that. Another note is that I will be sending the slides from Angela's presentation to all of you in a follow-up email after we finish up the webinar today. And again, this is being recorded, so we'll also be posting the webinar to the Nami Greater Cleveland YouTube channel later this week in case you were not able to join us from the very beginning or missed part of the webinar. So any final questions for Angela before we conclude today? Feel free to put them in the chat.
And if it's okay, I'm gonna upload my email in case people have questions. Yeah, and they can anytime reach out to me, email me. You can reach me via angelabanks@theclaritycouch.com or via my website, theclaritycouch.com, or you can contact Nami because I'm available that way. I'm involved in the organization in multiple ways. So I'm here as a resource, and I appreciate all of you for spending time with me today.
Thank you for having us.
Yeah, we gonna sit over here, y'all, watch news.
I see people saying thank you so much. If you all don't have any questions, that really concludes what I have. Feel free to reach out to me again. I appreciate it so much.
Yeah, thanks everyone for joining us. Definitely seems like there's a lot of gratitude in the chat for this webinar. So that being said, I will let everyone carry about the rest of their day, and thanks for joining us today.
Bye, everyone.